Have children when you want them, have children who you can protect from harm, and raise functional children. That is your single most biggest contribution to nation building.
Geingos stressed that effective family planning programs targeted at meeting the needs of poor populations can help reduce the number of children and adults who live in poverty and can make a powerful contribution to poverty reduction.
It is a rights issue. In addition to being a rights issue, it's also an economic issue. There are fiscal consequences when we do not provide access to these services. A lot of the social dysfunction we're seeing now is really from parenting that's gone exceptionally wrong. And us as parents, what we're doing to our children is we are passing on our trauma to them, who then pass on their trauma to their children.
Unwanted or untimely childbearing is one of several factors found to drive many families into poverty or that keep them in such conditions. According to national statistics, prevalence of adolescent pregnancy is at 19%, a figure that reaches as high as 30% in some regions. Ultimately, over 40% of children born to parents in the lowest quintile of family income remains in that income quintile as adults.
This is a national crisis, in my view. And the second part, Daniel, is we often talk about the youth demographic and the demographic dividend. Now, there is no demographic dividend when we cannot provide young people with economic opportunities. We cannot give them access to health and education. Yet this is the demographic that's hardest hit, and it's also the demographic that is itself bringing more children who cannot be protected either by their parents or by the system. So there is a societal, a policy, and a fiscal discussion.
Geingos wants more access to contraceptives coupled with access to sexual and reproductive information to prevent a population bulge which would undermine efforts to tackle poverty. Daniel Nadunya, NBC News, Windhoek.